I actually do not have any questions today myself.
All right. Do you have anything else interesting to anything to share, technically speaking?
Mary Jo?
Uh, I was just going to ask Avi about cardiac patients.
Okay.
Just in your notes, you say that they kind of fall into three categories generally.
Mm-hmm.
And you have a note of one just that has a pulse, a flooding pulse.
Okay, so actually, okay.
Yes, just that I'm not quite sure when you say flooding, what you mean exactly.
Flooding basically means it's a pulse that's big, that you can feel it. You don't have to search for it. You put your hand on and you feel it, and it's fairly large. It doesn't have to be aggressive, but it's not exactly three categories. It's basically because you ultimately want to get to that, because the treatment for the flooding pulse is really the treatment. Okay, in other words, the REN4 or the UB27 is really the treatment that you're looking to get at the end. Now, if the pulse is not rapid, you can use, side gallbladder 27 instead or something like that. But you do want to get there. The thing is that if they have the two other things beforehand, I'm assuming that's what we're talking about. One is that they have edema in the legs. And the other one is they have a very, very small pulse, okay, which is obviously the opposite of flooding. No matter how you describe pulses, a very small, weak pulses and flooding don't match up, okay? So that person is not a turn into flooding, but you will want to do REN4 on them eventually. But here's the point about those two other conditions is that when you have edema, you can't treat the heart until you start moving the edema. It doesn't mean you have to wait 10 treatments. It just means do the points to move the edema, for example, spleen 3, 7, 11, then treat the cardiac, 3 seconds later. And the same thing if you have a very weak, so because you can't push the heart against something that's not moving. It's like you're asking the heart, to bang against concrete, sort of thing. And then the other condition is when they have a very weak pulse, you're asking, it's really the same phenomenon, even though it's the opposite. You're asking the heart to pump something that's not pumping, that's just not enough substance. So you have to sort of build some substance first. So you're looking at spleen 6, pericardium 6, maybe something like that. And then treat the cardiac issues. And then with the cardiac issues, then you do, REN4 is like the big one. And then, yes, check UB60 and see, if UB60 is painful, you can do 66, 67. But also don't forget, a lot of cardiac problems are actually autonomic nervous system problems, or are complicated by nervous system problems because of the pacemaker issues. Okay, so that's, so I'm not sure if, if I said that there were three types, this is something that was written like 20 years ago. So it's a little bit of a misclassification. They're not exactly types, because eventually that third type, even though it says flooding pulse is REN4, it's really all of them should get down to REN4. It's just so you can't do it with someone with a weak, you don't start with that, with a weak pulse. And whereas if they don't have a weak pulse or edema and they have cardiac in the history, but they're not coming for a heart-related problem, you can say to yourself, I'm happy to start with REN4 for, let's say they came for neck problem or something. It wouldn't be my choice, because I don't like using REN4 right up front, because it kind of, it takes away the comfort of checking up the rest of the abdomen. So, it's like I check the abdomen and I go, oh, let me needle REN4. Well, look how many findings disappeared. But then, let's say all the findings disappeared, so yes, it's a great point, but then I missed my opportunity to check other points. Now, if I do REN4 and other findings did not disappear, I still have abdominal findings. Most patients don't really like the idea of having a needle in their abdomen and you palpating the abdomen at the same time, even though they may not feel it. It's not as comfortable. So, does that make sense?
Yes. Yeah.
All right.
Thank you.
Anything else?
There was a back treatment that David Euler taught for cardiac issues,
Okay.
and it was I I don't know if it's already ringing a bell, and I don't remember it, and I have looked for my notes on that and cannot find them.
Okay.
So I was wondering if you might
Yeah.
remember, but it was a very specific set of points on the
Okay.
back.
So I'll tell you, okay, so yes, you do get at the end, okay, so the back treatment is composed of two components. One is the remote component, and the second component, which is really, when I say everybody needs to get down to REN 4, that's on the front. On the back, everybody needs to get down to left small intestine 11, left outer UB line, inner border of the scapula, meaning UB 43, 44, 45. Those should be needled and moxed, but before you do those, they need to be released. Again, on the same principle. So it's interesting, both lungs and heart, no matter what you do remotely at the end with the lungs, also, you want to moxa, needle and moxa the area of UB13, and that's a large area, meaning from the spine all the way to the inner border of the scapula, where you find the gummies, and needle them and moxa them. For people with serious lung issues, that is really important. For heart people, cardiac people, going into taking that inner border of the scapula on the left and small intestine 11 on the left and needling is very important. But the problem is you're directly at that point affecting the heart. So you want to do everything you can before remotely. So on the back, what you'll likely have, check bladder 60, especially on the left. If it's painful, do 66, 67, that's metal water. If not, you can needle UB60 upwards directly. You want to do UB27, okay, or find the gummy in the sacroiliac joints to release those, the left side UB43 area and small intestine 11. do 2 also. Do 2 is more of an autonomic nervous system point. So do 2 generally eliminates left bladder 43, 44 area on everyone, cardiac or not, because on the left side that represents the pacemaker, so it's highly correlated with autonomic nervous system issues. So due to will probably eliminate that. So don't use that as your first point, because again, you won't be able to find other points. Some people, it's related to T11, T11, T12 can be very meaningful. And then you can do T7 and T5. And if T7, T5 are quite painful, do small intestine 9, 10. Now, somebody asked me this week about small intestine 9, 10, and I realized that people may not quite get what I mean by that. So small intestine 9, 10 is between 9 and 10, but both small intestine 9 and 10 are basically between the arm and the body. Small intestine 9, 10, the one in between, comes slightly back towards the scapula, slightly, like less than an inch for sure. And what you're looking for is you're looking for a place that when you press, it bounces back at you. It has a springiness to it, okay? And you needle that towards the deltoid. And then the last one that I will conceivably use, and this really will always be the last point, except the small intestine 11 and inner border of the scapula, is heart 3 can release that scapular area on the left side. But again, because it's on the heart meridian, you want to be very careful about, don't use it up front. So use feet points, address blood pressure, address blah, blah, address the whole, everything else. Then when they're on the back and you've addressed everything else on the back, then you go and surround small intestine 11. It would often be like gummy, not quite the size of a ping pong ball, but what do you call these little balls that kids play with? They flip them with the thumb on the floor, and they roll them on the floor. What are those called?
Not sure.
I have no idea.
Okay,
I
you
have no idea what you're talking about.
okay? They're teeny little. They're like marbles. Anyway, a marble actually is a good, little balls, marble balls. I think boys play them more than girls. But anyway, come on, Camille, didn't you grow up in an Italian neighborhood in New York?
We played jacks, and that had a little ball to it, but we
I don't know
didn't
what
have
that
a special name for it.
Oh, I don't know what Jackson is. So,
Oh,
but anyway, so a
okay.
little teeny little ball, like say the size of the small intestine 11 will be, say, the size of the tip of your thumb, maybe a little bit bigger, and it'll be often puffy. So you want to surround that puffiness with needles, let's say 3 or 4 needles, and then you can moxa them. And the inner border of the scapula, the outer UB line, needle whatever is left there towards the scapula and moxa. So as far as I know, that would be the back protocol for cardiac when you're looking at cardiac purely. Now, so for example, David has a very strong affinity to using liver 1 and looking at liver in cases of cardiac. So, wood is the mother of fire. So it all makes sense. In my experience, this is not to discount, what David's saying. My experience is that liver can be a contributing factor. Yes, you have people with liver issues. I mean, for example, look at how many people with cardiac issues get clotting factor, like are on blood thinners. Okay, so there is a connection between the liver, but it's that, to me, I would classify it as that would be part of treating the liver. So when I'm treating cardiac, I'm also treating everything else. It's not like the person comes and I'm only treating cardiac today and I'm not touching anything else. So for me, while there is a correlation, I would not go, I don't think of liver 1 or on the back UB35, left UB35 as a cardiac treatment. I think about it, if I find liver, I will treat that. And in the same way that if you find, adrenal, which can be quite common with cardiac, look at treating that. But I don't automatically associate it. Now, what you do see is that the spleen and heart are highly correlated. Spleen has a stronger circulatory connotation than we tend to associate with it. We think of spleen as digestive, and yes, that's true. And I think part of the reason is that the circulatory system is actually subservient to the digestive system in a weird way. Okay, because the whole purpose of the circulatory system is to take the digestion and move it around, not the other way around. Where we don't have a digestive system to serve the circulatory system. We're having a circulatory system because we have a digestive system because we're too big to, unlike a single cell organism, we can't absorb nutrients and get rid of waste through cell walls as an organism. So we started developing a central canal to take food in and put it out, and something happens in the middle. And then once the organism gets a little bit bigger, then it needs something to take the food from, if you just have a few cells, the central canal works and, no need for circulation. But at some point you need some circulation. That's where the heart gets developed and the vessels get developed. So I think there's a very strong correlation between the spleen and the heart. In my opinion, stronger than the liver and the heart.
Interesting. Thank you.
And by the way, that's true emotionally too. Emotionally also too, not true. Because the spleen, the yi is the expression, literally, the character is the expression, the words of the heart. And without the yi, you're not going to get any emotional problems at all. Because if you have no cognizance, it really doesn't matter. You can have all the problems out there, but if you're not cognizant about them, you're not going to have an emotional issue. So all emotional issues are also highly correlated. We say Shen disturbance, but it's still, in my opinion and experience, the spleen has a very strong component, and much stronger than we tend to attribute theoretically to it. Does that make sense?
Well, absolutely, because when I taught theory, I taught a very strong relationship. So,
Oh. Well, you should be writing the book for Giovanni's next book.
no, thank you. No, thank you.
In Croatian.
Oh, good luck with that.
Yeah. Anyway, anything else?
I just one other small thing, Abby. I just have a patient with it's a little kind of black, like a little pin mark, roughly around UB23 on the back.
Okay.
Kind of a little swollen and with a black center, epicenter. Now this person was in Africa for a number of years, and they're not sure how it developed, but maybe some kind of insect thing bite. But it's kind of like prominent to the skin,
Mm-hmm.
you know, like a little circular, and with this black little center. This, you know, you know, it looks, the black part looks prominent as well. And I was just wondering, is there anything that you might think about in that situation? Or I know you mentioned before about somebody that had a vaccine, I think it was.
Yeah,
and it kind of led you to some other treatment. I was just wondering, had you any thoughts about that one?
Okay, so I don't have any thoughts unless it starts ringing more bells. In other words, so because, you know, quite honestly, skin and my understanding of skin issues, like, you know, can I tell you, well, this is a blah blah, and this is a melanoma, and this is I have no context to give you something like that. So yeah, I mean, something with a black thing in the middle sounds like does sound like a bite when something, especially if they say, well, they came from Africa or they lived in Africa or something, it would suggest that. The fact that it's raised off this, it sounds like it's raised when you're saying it's, okay, suggests that there's been a strong, at least histaminic reaction in the area. Now, the question is it interfering with anything else? So the question is it just something that we notice and it's quote unquote an aesthetic issue, like I just note, I'm just seeing? Or is it something that the patient says, I have pain on it? Or can I relate it in a way, and that's the most common one, I'm looking at something like, say, a scar, a bite, or whatever, some sort of abnormality in the way the tissue is operating. And then I'm saying, I want to know if this, first of all, two things I want to know. I want to know, does this have any pressure pain on it? With the assumption, sorry? There is?
No, it doesn't have any pain.
Okay, so it itself, from the primitive perspective that I'm presenting right now, given that I'm not a skin type person, you know, I'm not a dermatologist, I can't evaluate it really. From the primitive perspective, it seems to, it itself is not a problem. The patient didn't come for that, and when I try and elicit something on it, it doesn't create anything. Next, now I look at their problem, say it's an ankle pain, okay? And then I say, when I press on this black pimple, whatever it is it releasing the ankle, or is it releasing any abdominal findings? If it is, then I'm saying this is contributing to a deterioration, some sort of, it pulls away from the body's ability to work. This pimple, this bite, whatever it is. And then I'm saying, okay, I want to treat it. So now there's a few things I need to look at. If it's actually painful, I need to release the pain using something else. So let's say I say, oh, it's a poisonous bite of the African spider, blah 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 blah, whatever, make shit up, right? And I say, okay, I can use detox. Let me see if kidney 9 and large intestine 15 will release this bite, what I think is a bite, and release the pain here. If not, I can actually needle it or surround it in moxide, or I can do a bunch of things with it. And with the assumption that, okay, now it releases abdominal findings, now it releases release of the ankle. And if none of this applies, if it's just a bump, for the most part, I would tend to let it go. If the patient says, by the way, can you do so? I really, I have this weird bump, and every time I wear my bikini, people say, why do you have this bump? And I have to go through the story of Africa and the bites. What I would do is I would do the skin treatment, the local skin treatment, which is I would surround it with Prestax, put aluminum foil over it, and tape it down. Now, I don't know what kind of aluminum foils they have in Ireland, because they have slightly different ones. In the US, we have regular and we have extra duty. Don't use extra duty. The really heavy ones don't use regular aluminum foil. Now, some countries have extremely thin ones, and they're not so useful, in my opinion. I don't have as much experience with those, only when I teach somewhere. But so what here in the US we call regular aluminum foil. I put a layer one on it, doesn't matter which side, shiny or, tape it on, connect because you have a 3 bypass cord, and connect the red and the green of the 3 bypass cord to the aluminum foil, spark the whole foil, and connect the black clip to the aluminum foil. That's a very good treatment for skin in general. Now the question is this thing in the skin? Is it really below that? I mean, obviously there's something in the skin because of the black, but is it much below? So that's what I would do if there was absolutely if it was truly a quote unquote cosmetic phenomenon. Like, I don't mean pretty, but just like, it's a question of I'm seeing it, but it doesn't appear to suggest a malfunction, either within itself or affecting the rest of the body. Otherwise, I would try and resolve it. Now, you can also resolve if it's on UB23, points that will affect UB23. So yes, kidney 9 possibly would, because you were looking at it conceivably for toxicity. Kidney 7 is another possibility, and lung 10 is a possibility for the area.
Yeah.
So
the person definitely has adrenal and goiter. So I have actually been doing 9.
Yes. Yeah.
Actually not on the side of the bump, but have been doing 9.
Yeah. Okay. So yeah, but that would be my general approach to something like that when there's a bump on the skin and you're not sure, and just determine. So I would conceive, so you have your abdominal findings and you have something on the goiter, something on stomach 9 area. So I would even venture to, with them facing up, press on the UB23 area, on the bump, and see if the goiter gets better. Or I don't know, whatever other findings they have. And then you just satisfy yourself, and you can say to them that, oh, this seems to have an effect. Or you can say to them, you can relax about it. It's just a bump. Or it appears to be just a bump, because you can't really, it's like you don't want to get sued when, in 20 years someone said that, by the way, why didn't your acupuncturist, send you to blah, 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 blah. So that would be my approach. Unless they have pain on it, then I release it remotely. And if they don't have pain on it, and it still affects something else, then I would treat it. Or I would treat things that would treat it. So sometimes I may not needle it, but I'm thinking, oh, this comes from toxicity. Let me try kidney 9, large intestine 15, see what effect it had. This is, I think it's an autoimmune reaction. Let me try immune points and see what effect it has on the patient's body. So it can basically leads me to more ideas, to more thinking.
Mm-hmm.
it isn't necessarily automatically a pathology that I automatically have to address, unless it shows itself as such.
Okay, thank you.
So on that note, I'd love to hear what you have to say about goiter.
Oh, goiter generally is a kidney 9 category, usually. So thyroid generally is in the, okay, oh, okay. Sorry. Okay, so thyroid is in the kidney category. So, but goiter is not, goiter is kidney, is thyroid, but it's not necessarily affecting the function of the thyroid, and for many people. So, so generally hyperthyroid is kidney 7. And officially, and quite honestly, in my experience, that's not true. Officially, kidney 3 towards the Achilles is supposed to be for hypothyroid. I don't find that it's true. I don't find kidney 3 all that effective. Maybe it's me, maybe whatever. I actually find that kidney 7 or kidney 9 are usually the effective points for hypo as well, and kidney 7 for hyper. On the back for, and I'll get to the goiter in a second again. On the back for hypothyroid, you want to stimulate the spine, so it's do 2, and possibly do 4, then T11, T12, T7, and T5.
Whoa, slower? Can you repeat
Yes,
that, please?
of course.
Thank you.
Do 2.
Do 2. Mm-hmm.
Possibly do 4.
Okay.
Quite honestly, it's rare, okay, that I find do 4. T11, T12, T7, and T5. Now, the reason I didn't even feel like it was worth going slower is because this is my standard. No, this is like my standard for absolutely everything on the spine. Why? Because these are places where the curve is either at its height or where it changes from kyphotic to like lordotic. Okay,
Mm-hmm.
so it's basically when you take a bow, the height of the bow is going to be the place where there's going to be the more repercussions. The highest resonance, the highest vibration is going to be at that where there's the biggest change, and that's why, so it's pretty much every person you get in. There are going to be exceptions because there'll be people with different curvatures and stuff like that, but pretty much everyone is going to get T11, T7, T5, and when I say T7 and T5, it can be T9 and T3 or T4 also. Okay, so it's a range, but it's those places where the curvature is amplified. Therefore, you're going to get more per needle there in terms of calming down the structure and calming down the nervous system. Okay?
Mm-hmm.
So that's why I kind of don't even think twice about it. So that treatment, that's for hypothyroid, which is quote unquote lack of yang. So you're activating the yang, you're activating the do. That's not necessarily the best treatment for hyper. So for hyper, I might look more for UB52 rather than stimulating the do channel. I might look at UB52. I might look at UB42. In other words, lung and kidney outside the shoes.
Mm-hmm.
Which is similar to autoimmune. So back to goiter. So goiter has, so besides being so it's kidney, and it's supposed to be kidney 9 category as opposed to kidney 7 category. The other thing about goiter is liver 8. Any growth in the body is a liver 8 phenomenon. Any cyst, fibroid, whatever you want to call it, because these different growths are called something else depending on the location. Like, why isn't it called, no, I mean, how come, you call a uterine fibroid, but it's an ovarian cyst, and it's a thyroid goiter, they're all accumulate. I mean, granted that they can be of different substances. Some are more bloody and some of them are more pussy, but they're all basically overgrowths. Accumulation of substances. Anything like that is a liver 8 category.
Mm-hmm. Mm-hmm.
Okay.
And do you find the ear thyroid point helpful or not involved here?
Well, wait, what do you,
I mean Kiko's point, the one behind
mean
the
the
ear.
behind the ear? Okay, the kawaii, yeah. And I think in the Shanghai text, it's called the young linking point. So
Because I don't find that point really that helpful
interesting.
overall.
Huh. Okay. You see, like I say, I don't find liver one for cardiac issues. It's like
Yeah.
I think um, I actually do find it's helpful. It's actually a very helpful point for a number of things. I mean, first of all,
Okay.
it releases the neck in general. No, you're talking about the one where you pull the ear in the front and go under the tendon, right?
Yeah, exactly.
Okay.
But the
Um,
lowest tendon, Abby, that's the one you mean when you said it was the lowest tendon.
the lowest, yeah, because some people will have a bunch of tendons, so go below under the lowest tendon. So,
I mean, I tend to use it more for things like Hashimoto's or
so
that
you're
sort of.
saying it doesn't work so well for goiter?
Yeah.
Okay.
Yeah.
That that may that might be true. I mean, it is a point that's very good for neck. In general, it releases the neck in general, and releases, and because of that, releases the nervous system. Um, you know, I honestly, I can't say that I have a clear recollection of this really works great in goiter or no, this sucks in goiter, because I kind of like I add it sort of automatically.
So when you say releases the neck in general, that's so broad. Is there? I
Yes,
mean,
it is.
are you talking more about the throat? Are you talking about the back of the neck? Or
More okay, the tendency is not so much for this. Well, actually, it does release the cervicals to some extent, but it releases the SCM a little bit better.
okay.
Um,
Okay.
it releases the front better, but when I say the neck, I mean the whole area, including shoulders, including even gallbladder 21, although it tends not to get as far out as gallbladder 21, but
Okay.
pretty much the whole neck.
Oh, okay. I
It's
haven't noticed that, but I'll pay more attention.
yeah. I mean, it's not my primary point for it. To release neck, it will be something I would add it.
Yeah.
Some people have some neck problem or they can't turn the head, and you do Sanjo 8s and you do whatever you do, and then there's still something left, and that's when this point can, make a big difference.
Okay. So anything else for goiter?
Uh, well, so depending on where you think the goiter is coming from, so if the goiter has something to do with some hormonal or pituitary issue, then treat that. So, small intestine 3 or
Okay.
UB2, so check UB2 if there's pressure pain on UB2, or check the occiput and use, possibly UB66, but small intestine 3 is more directed towards the pituitary, in my understanding. And
Right.
UB66 is more directed at the actual hormones, like the actual substance. I know it sounds a little hokey, but that's my sense of it. Small intestine 3, it's the opening point for the do, but also the points. Small intestine 2 and small intestine 3 are called before and after, have a before and after character in them, before the valley and after the creek. Okay. And you have the exact same character before and after at do 19 and do 21, before and after the vertex, around do 20. So in between them and under them is going to be the pituitary. So that's, for me, small intestine 3 has a strong brain correlation, which UB66 does not have. UB66 is a good hormonal point, but it's, it wouldn't be if somebody said I have a pituitary gland tumor. I wouldn't think of UB66 first, but I would think of small intestine 3 first.
Okay. Well, and Kiko always calls UB2 the pituitary shoe point. So
UB2, I
yeah.
would think 66 though. UB2 is your reflex, and that would be actually, in a way, it will be called the pituitary moo. I don't know. But yeah, so okay, so in the link shoe, there is a mention of Ming Man, but it does not refer to do 4. It very clearly, it happens twice. Actually, it happens 4 times, but it's really twice because it repeats itself. And it's both times it's in the description of the bladder channel or something to do with the bladder channel. And it says Ming Men. Ming Men is in the eye. So clearly whoever wrote these 2 chapters in the Ling Shu that mention Ming Men understands that that they're using Ming Men differently than everybody else already then. Okay, 2,000 years ago, because, you know, when they're saying Ming Men and they have to explain to you that it's in the eye, meaning I don't want to call it UB1. Okay, I'm refusing to call it UB1 for whatever reasons the author has, and I want to call it Ming Men. But I also recognize that nobody else is going to know what the fuck I'm talking about, so I'm going to tell you Ming Men is at the eye, and you all know that the eye, you know, where UB1 is and how it relates to the bladder channel. So it's clear that bladder 1 is supposed to, you know, that is referred to as Ming Men by this author. And I think that the intention there is to say, Ming, you know, that it suggests that it's a hormonal area or a pituitary area or something along those lines, something to do with, you know, something that controls destiny. And, you know, we can say that hormones do control destiny. So, you know, I think that the reason why they wrote it that way, of course, you know, it's not like I have literary, you know, conversations with whoever this person is that wrote this chapter. But it seems to me that they clearly wanted to make a point that there is something about the connotation of Dufour or the line of Dufour in bladder 1 or the eyes. They wanted to suggest that there is a strong, that whatever we associate with Ming Men, we should associate with bladder 1 area also. And since bladder 1 is not a nice place to poke or needle, bladder 2 becomes the, you know, the substitute. Plus bladder 2 is, you know, kind of quote unquote, it's right outside yin tang, so it has this whole upper dantian, if you want the mystical connotation or whatever. So it kind of makes sense that it would deal with, because the upper dantian would be the hollowness of the brain, the activity of the brain. So you have, you know, so you have kind of reasons why UB2. And then you just see it practically speaking, let's be honest. You know, women come and they have hormonal headaches. They're very commonly at UB2. You know, not the only area, but it's a very common place for hormonal headaches to take place.
Yeah. Now, what about thyroid cancer? Or what about if you're not sure if the goiter is developing into cancer? Do you have any additional thoughts or variations?
So with cancer, I mean, so there's a few dogmas with cancer. Cancer, always treat thyroid, always treat liver. Now you're treating thyroid anyway because it happens to be on the thyroid. Now, thyroid cancers are an odd, well, for the most part, are odd phenomenons because they're very slow growing, and that's often why they can't tell. Most cancers that they find on the thyroid, they kind of let go for a long time. You know.
Although actually they're becoming much more prevalent here in California, and I think it's because of Fukushima.
Oh, great. And another contributing factor. So to take, no, yeah, it makes sense. So always treat liver in cancer. Always check REN12, by the way, in cancer, and treat thyroid. Then in terms of actual cancer points, what you have is liver 9. And you have under the second toe. So not under the third toe, under the second toe is supposed to be a cancer point.
Oh.
How effective that is, I'm not 100%, I can't tell for sure, but liver 9 definitely is a worthwhile phenomenon. And then immune points. And on the back, I would definitely look at UB52 needled, you know, besides treating liver, thyroid, needle UB52 towards the spine. And well, actually, and UB42 outwards. You're basically encouraging discharge of waste through the lungs and the kidneys.
Okay. And I always thought of under the second toe as a cardiac point.
On the left side, the same point under the left point, okay. on the left side under the second toe, I now got the phrase right, is indeed a tachycardiac point.
Tachycardia.
Yeah,
Okay.
it's not for slow pulse. It's specific
Ah,
cardia. It's not a cardiac in general. And so while we're on cardiac, the one thing I wanted to mention well, actually it doesn't matter so much, but gallbladder 39 is a cardiac point if they have irregular pulse. It came to my mind when we were talking before about cardiac. So I just thought I'd mention that. But yeah, it's the same exact point, except it's on both sides. And again, somebody with a slow pulse, it does happen. There are some people with cancer that do have a slow pulse. It isn't super common, but it does happen. Then that point is not so good for them. The points under the toes are not great for, they tend not to be super great for people with slow pulses.
okay, interesting. So any other thoughts on thyroid cancer?
No, I would really check REN12, and you can fix it with either kidney 9, stomach G, and or at the end you want to get to immune. Do liver 9, possibly use the point under the second toe, but otherwise, and check the liver very well. And because someone with cancer, you want to make sure that the digestive system is working at as optimally as possible, and that the liver is working as optimally as possible. And once they get into the chemo stage, then the liver is very clearly a priority. Clearing up the liver. It's even if it doesn't show, because what person can take chemo and not and the liver won't be affected. It kind of doesn't make sense that it would happen. So it kind of I would take it as a dogma, but otherwise that's pretty much it. Treat the thyroid, treat the liver, treat the stomach, stomach, small intestine, treat immune, and the only quote unquote cancer point, which of course we can all be arrested if we said we had one, is liver 9.
Thank you.
That other point, Abby, the normal kidney 9 point.
You mean three fingers below?
Yeah.
10. Okay, that point should be extremely popular nowadays. That's specifically for opiates. So for detox from painkillers and opiates. Not for other. It's not, generally speaking, kidney 9 for any kind of detox. Kidney 9 is the point. But for opiates, it appears at the point. So you know how kidney 9 is at the base of the gastrocnemius, right? So if you had the person handstanding, so the base of the gastrocnemius now is just quote unquote above, kidney 10, because it's all upside down. But it's where the muscle begins to bulge, and that's usually about 3 fingers below kidney 10, and that's the other kidney 9 that's meant for specifically opiates, painkillers, morphine type. That's your Sherlock Holmes kidney 9. So
you're saying the regular kidney 9 is where the muscle begins to bulge?
Yeah, because like kidney 9 at the bottom is where the muscle begins to bulge out. It's at the base of the gastrocnemius.
Yeah, but that's like a lot more than 3 sun from 10, isn't it?
Sorry?
That's a lot farther down than 3 sun from kidney 10.
No. Okay. First of all, 3 fingers. No. Regular kidney 9, which in the books. Okay. So the original description of kidney 9 was at the base of the gastrocnemius, and then they said about 5 tsun above kidney 3. Unfortunately, the more modern books say 5 tsun above kidney 3, and they forget that part, that it's at the base of the gastrocnemius. But it's the point of it is that it is at the base of the gastrocnemius. Then the other kidney 9, the detox one, if you go about 3 fingers below kidney 10, what you notice is the gastrocnemius bulges at the lower kidney 9 and bulges for X amount of time. And then it doesn't like end at the knee. It's sort of, the bulk of it kind of ends a little bit below the knee, about 3 fingers below. And then it's sort of a little flatter until kidney 10. So it's those 3 fingers below kidney 10, that flatness, go down them, hit the muscle, and that should be your detox kidney 9, your morphine kidney 9.
And is that the same as the radiation point? Because I learned doing top and bottom of the gastrocnemius for radiation issues.
Oh, that's very cute. I have not heard of that. It kind of makes sense to me in a way, because the gastrocnemius should reflect all the organs. You should be able to find a reflection, just like you should be able to find a reflection on the SCM of all the organs, because all the weight and all the lymphatic goes, is related to the gastrocnemius. So I guess it's some sort of method of affecting all the organs and the lymphatics of all the organs, but I personally have not heard of that.
That's interesting, because for the last 25 years, I thought I learned that from you.
Oh, well. Well, then maybe
I thought that was a Kauai treatment or a Nagano treatment or something like that.
Then, okay, so let's put it this way. It's possible that it came from me, and that once upon a time I knew that, and then I forgot it, and now
Yes.
I'm reminded. So
I understand that.
the only thing that matters is if it seems to work, then I'm very happy to reclaim it and say, I'm going to try it again. And I will say I learned it from Camille 2 days ago. So, no, it's amazing how you kind of like, there are things that, you used to, I was just thinking about that the other day, like there are things that used to be part of my vocabulary are totally not part of my vocabulary.
Yeah,
and of course, I'm at
absolutely.
the age where I forget a lot. So I can't guarantee what I said 25 years ago. It sounds like a useful proposition, or a conceivably useful proposition. So what else can I say?
Eczema, especially autoimmune eczema. Could we address that?
Sure. So if it's autoimmune is one of those conditions that's always going to take over as a primary.
Yeah.
So in other words, treat autoimmune, meaning kidney, lung, and REN4, and on the back it's UB27 with UB52 and UB42. Okay, so again, this idea of UB52 inwards and UB42 outwards, it's encouraging this, releasing. The other, in terms of skin, it's kidney 9 and large intestine 15. It's like toxicity. Originally, that treatment, we called it skin treatment. We didn't call it toxicity treatment. Okay. But the idea is that skin creates, that there's toxicity in skin, so it was kind of like expanded. And then, so you're looking at your autoimmune treatment, kidney, lung points, and REN4. If you can't do REN4 because the pulse is slow, you can do Mushu, side gallbladder 27. Treat this, treat kidney 9, large intestine 15, treat immune also, and which is part of the autoimmune protocol. And then whatever else they come up with, I mean, is there a liver component? Is there a blah, blah, what other components are there past the autoimmune toxicity phenomenon? What is in the medical history?
Well, in one case, there are a lot of food allergies, gluten and lots of other things.
Yeah.
Like a real gluten allergy, not a pretend one.
Not a pretend one. In other words, I'm not trying to lose weight. I really get sick. So I mean, when you say real, you meaning it's silly?
No, like she really does react to almost everything.
Hugely.
Her diet is so limited.
Okay.
That it's hard to maintain, and a lot of times she just eats the wrong foods, just, knowing she's going to get a rash from it just because she's bored.
Yeah, okay.
Well, because if you can only eat 8 foods in the whole wide world and you're in your 60s, after a while, you want to eat more than 8 foods in your life.
And you've discovered every single way to fry them or whatever. Yeah, no, I of course. So I will tell you this. I am not the best person with food allergies by any stretch of the imagination.
Okay.
When I do treat, so what you can, food allergies should be related to the liver. Okay.
Oh, okay.
Definitely, because that's all the food, especially all the lipids are going to be taken into the liver. And on the way, there's a lymph called the cisterna chyli that kind of stores the lipids as they're moving towards the liver from the small intestine. And that you can find around L2, do 4. But up to T12 it can be, between T12 and L2, go slightly outside the Watteau line, but still medial to the bladder line. Okay, and you might find like a nodule-like feeling there. That's the cisterna chyli. Usually you find it more on the left side, and you can conceivably affect food allergies that way.
Huh.
The navel, around the navel, they may have tightness as allergies in general, but food allergies, for me personally, the better ways of treating them are less with, for me, I haven't been that successful with acupuncture. What seems to work is the different AK methodologies with holding vials. That seems to affect the nervous system in a different way and therefore calms the way the tissue is reacting to the allergen. However, when you say, so that's a separate story. But in terms of, okay, so she has all this basically great inflammatory capacity in her body, is what you're saying. Then
Right.
Okay, so this is what I would look at. First of all, check all the fire points of all the meridians, because you don't know which it's going to be, and do metal water, because you're already doing systemic metal water by doing the autoimmune. So if you want to add to it, after you do that, check all the fire points in advance. After you do the autoimmune treatment, check which fire points are left. Hopefully not too many. Okay, so the ones that are left are conceivably the ones that are the big ones that there are, and do the metal water points for those meridians. Okay. You can also look at stomach 41, which granted is the fire point, and take stomach 41, just go over one tendon from gallbladder 40. Don't go from the side of liver 4. And so take it a little bit more lateral and needle it towards gallbladder 40. That's considered an anti-inflammatory point.
Oh.
Okay.
Oh.
Especially for the digestive system. Another anti-inflammatory point is so-called pericardium 8, but here's the trick here with this pericardium 8. It's not as effective as the stomach 41, in fairness, but it does do something. What you do is, instead of taking take pericardium 8 the exact way that Chinese acupuncture Mark Sebastian says, which is between the index and middle fingers. Pericardium 8, in my opinion, should be straight down from the middle of the finger, or it should be between the middle and the ring finger. But there is a version of pericardium 8 that's between the index and the middle finger, and you go down. To me, that doesn't make a lot of sense as pericardium. It's too lungy-ish. But in terms of anti-inflammatory, that's a decent point. And the other anti-inflammatory point that's often very good, and especially with skin, is large intestine 2. Which again is part of metal water because it's the water point of large intestine. And sometimes large intestine 2, instead of taking it between the finger and the hand sort of thing, take it in the proximal interphalangeal joint. It's a mouthful. In other words, you have 3 joints. So large intestine 2 is usually between the 3rd joint and the actual hand and the palm. Go 1 joint towards large intestine 1, that's often a better large intestine 2.
Huh.
A good
Okay.
moxa point.
Okay. Wow. Super. Thank you.
You're welcome.
Those are some really good new points.
Good. Hey,
And
they're
I thought I didn't have any questions today.
good. Well, no point as new. Everything very ancient.
Yes, fabulous.
2,000 years. We always claim that medicine is very ancient.
New to me.
Yeah, well, as well as to me, apparently. All right. Anything else before we end?
No, I don't think so from me anyway.
All right.
No, that was super. I really enjoyed today. Thank you so
Good.
kindly, Avi.
You
Thank
are
you very much. And thank you, Mary Jo.
Thank you. And I'll see you maybe next week, and enjoy the new year.
Absolutely. You as well. Thank
Thank
you so kindly, Avi.
Bye.
Bye-bye.
Bye.